We're just getting started on the right shoulder here. We're looking at it from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. And right off the bat, we can see that this biceps anchor and the superior labrum are torn just like we expected. We're using this instrument called a shaver just to smooth out some of the labrum so we can see a little bit better. And then you can see the rotator cuff that's torn is right here hanging down. And so we'll use our shaver here just to take away some of the torn cuff so we can make a better decision about what to do. But right off the bat, it looks like that tear is deep enough. See how the shaver just drops right in there? Come down right here. See, this is where it should be, and then here it just drops in that hole. So we're going to have to work on that. We'll take a marker stitch and mark that after we fix this biceps here. So the next step is to take a stitch, pass it around the biceps tendon. So here we are placing this white stitch down here. Trick is to sneak around the other side now to retrieve it. And what that does is it gives us this loop of suture going around the biceps, as you see there. Now we'll take a spinal needle and we'll do our best to pass it right through the middle of the tendon here. It's a pretty good shot right there. And we'll go ahead and take an instrument called the grasper. Pull that out, and then outside your shoulder, we're going to load one limb with a suture. There you can see we've got one limb of the suture going through the biceps. Now we're going to do the same thing one more time. There we are, coming through the second time. Pause, please. Okay, so we're just clipping the biceps here now that we have it secured. Are we? Yeah. Okay, so we'll go ahead and clean up or smooth out what's left of the labrum. A little bit of bleeding, that'll clear up in just a minute. We'll get you a nice clear picture, but we're going to work on the rotator cuff next. Get down here to the right. As we look down the front, the anatomy here looks pretty good. So we're going to go ahead and put the camera in the front, have a look from the front to the back. Possibly. Okay, here we are looking from the front to the back. We've smoothed out this labrum back here. And hopefully that'll take care of that, especially now that the biceps is no longer pulling on it to loosen it. We can confirm that down the front of the shoulder things look just fine here. Hold the camera for a minute. there. I can feel it drop into the hole. We're going to mark this with a purple stitch. Okay, pause. Okay, Jerry, so here's the hole in the tendon right here. Where it gets smooth, that's down into the joint. But this is the hole in the tendon, so we're going to place a suture anchor right about there. The next instrument you're going to see is called a punch. Here it is, and again I can lift up the torn tendon, and this goes down into the joint there. So we're going to come back right about here and place an anchor right about there. Back just a shade. That's just a starter hole. Into that hole we're going to place our screw. There it is coming down. And once we have it deep enough, we're going to unload the screwdriver. And you'll see 3 different sutures, a blue one, a black one, and a white one. We'll reach in from the right side of the screen, which is the front of your shoulder, spread them apart. We're going to start with the white one, then we're going to go with the black, and then the blue. So here's the white one first. We're going to pull this into this, into that cannula there. We'll pull tight on these other sutures. Okay, and so then here from the back of your shoulder, which is the left side of the screen, we're going to come in with a suture hook. Here it is right here. It's loaded with a black wire called the super shuttle. There it is there. Push past these other sutures with our scope. You can. Underneath, and there is our little hook coming underneath. Feed that black wire, retrieve it. Pause. Okay, now we're getting ready to make our second pass. So we have another hook in. We're going to grab this tendon. We know we want to reduce it, so that it sits flush right about like that. There it is coming underneath. I'll show you some more in just a second, possibly. Okay, now we're going to go to time these one at a time. We're going to start with this white one here. there. We'll keep trying this and show you some more in a minute. Okay, we're all done here. We've got this tendon completely repaired. Here we are anchored down to the bone right here. And that looks really good. The hole's been completely covered up, so it's actually hard to see. Well, you can't see into the joint anymore, but there you can see where the hole was. And you can see the sutures up on top holding everything down. Okay, so we're going to finish up here and get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.